Hello everyone, you're watching PhysioClassroom channel, and in today's video we are going to learn the manual therapy skill to perform the prone shoulder mobilization technique to break adhesions and improve mobility in frozen shoulder patients. The technique is intended to improve the elasticity of the ligaments and the capsules that are attached with the glenoid labrum. So let's get started with the practical demonstration of prone shoulder mobilization technique. So to deliver this technique, the therapist makes the patient lie down in prone lying position, and the side that needs to be treated is placed in such a manner so that the shoulder and arm are hanging at the edge of the couch. Care should be taken that the hand should not touch the floor, and in case it is a low treatment couch, a pillow can be kept under the anterior part of the patient's shoulder. The therapist next sits directly in front of the patient's arm that needs to be treated, and then cups the patient's humerus in such a manner so that both the fingers meet together under the axilla and both the thumb pads are placed right next to each other over the deltoid muscle. The therapist now delivers a tractional force in the downward direction and then start moving the shoulder joint in a hinge manner, performing small arcs of shoulder abduction and adduction movements. So the glide or the mobilization that is being performed, the hands are being moved in this fashion. So this particular mobilization of small arcs of shoulder abduction and adduction needs to be performed rhythmically for around a minute or so. Now after delivering this first stage of the shoulder glides, the therapist next repositions the patient's arm to the neutral starting position and then start delivering shoulder glides so as to perform the clockwise shoulder movements for around 1 minute and then anti-clockwise shoulder movements for 1 minute. Now after this, the shoulder is again repositioned to the neutral starting position, and for the third and final phase of the prone shoulder mobilization technique, the therapist now starts delivering glide to the humeral head in such a manner so that the head is moved in a figure of 8 manner. So every time the head is being approximated and then distracted away from the glenoid cavity. So if we closely follow this movement, this would look something like this. So this was all about the practical demonstration of prone mobilization technique for frozen shoulder patients. Do assess for the improvements in functional ranges as well as decrease in pain post treatment. Do share with us your valuable feedbacks, and see you all in our next video. Till then, keep learning, keep sharing, and stay connected.